Hello, I am Dr. Jeevan. I serve as a community health physician after having been trained in community medicine from the Christian Medical College, Vellore. Of late, I had made few videos on COVID-19 in Hindi. This video in English is in response to requests from my friends and students who have attended my courses on primary care. So today I'm going to tell you on how one can contract or one can get COVID-19. Of recent in my clinic, we have had patients who have been tested COVID positive. The commonest question I was asked was, how on earth did I get this infection when I have no history of any obvious contact? As you know, an infected person can spread the virus through secretions from their mouth or nose. These secretions are basically of two types: droplets, which are big drops varying from 10 to 50 micrometer. They are heavier and they can travel for about 1 to 2 meters when a person coughs, sneezes or talks. People who are in close contact within 1 to 2 meters of an infected person can get the COVID-19 if these droplets get into their mouth, nose or eyes. Now this is the reason why we ask everyone on the road to wear a cloth mask. Now some of the drops that come out along with the droplets are more smaller. We call them aerosols. They are about 100 to 1000 times smaller than droplets. As these are very small, they remain suspended in the air for long. Aerosols may not be a big issue in open spaces, but there is all evidence to suggest that they can cause major transmission in closed spaces like vehicles, rooms, and even open spaces like markets, stadiums, etc., where there is a lot of crowding. The only way one can prevent aerosol transmission is to avoid crowds and not to go into enclosed spaces. If you definitely have to go to an enclosed space, you need to wear a special N95 mask along with a face shield. And if you are in the healthcare profession, please do ensure that you wear a special personal protective equipment if you are in touch with confirmed COVID-19 cases. Do remember that N95 masks can only be used once. There are some special ways of using them 2 to 4 times, and they have to be fully fit on your face, and even after all this they may give you only about 85% protection. Now there is a way of indirect transmission where people with the virus, when they cough, sneeze or talk, they can leave infected droplets on objects and surfaces. People who touch this infected surfaces or objects and then put that infected hand to their eyes, nose or mouths can get the infection. That is the reason that we ask that along with mask, it is absolutely necessary to keep the hands clean and the surfaces clean. One has to also avoid the common practice of touching your face unknowingly. The other question that we are asked is about on who all can transmit the illness. As of now, we roughly estimate that 40% of all COVID-19 infected people are totally asymptomatic. So these people who are totally without any symptoms can transmit the virus. Those infected can transmit the virus when they have symptoms as well as just before they develop symptoms, which basically means that you can get infected by a perfectly normal looking person who is either infected but asymptomatic, or he is just about to become symptomatic. So I hope that this makes you understand on why we ask you to avoid going outside unless you have a real need. If you go out into public spaces, keep at least 2 meters away from each other. And last but not the least, you need to wear a mask. For public spaces without crowding, a cloth mask is enough. Public spaces with crowding and enclosed spaces, surgical mask or an N95 mask with a face shield. Keep your hands clean. All of us have the habit of unknowingly touching the face. Soap and water is much better than a sanitizer. Reserve the use of sanitizer only when you go out. Please do send questions and queries. Please note that the whole world, all of us, are still learning about this virus. Do remain safe and healthy. Thanks for watching. Bye.